Asad Latif, and today I have the topic of the terminal stages of death, which I have to explain. So basically, we have four stages of death, four basic stages of terminal stages of death. First one is the pregony, and then we have the agony, and then we have the clinical death, and after that we have the biological death. So I will describe and explain each of them in detail. First of all, we have the pregonal stage. Pregonal stage is a stage which lasts from few hours to few days. During this stage, the body metabolic process begin to slow down, and the person may experience loss of appetite, loss of blood pressure, weakened pulse. The person may become agitated, restless, and confused, and experience hallucination and delirium. This stage is marked by surge of sympathetic nervous system, causing a spike in the heart rate, blood pressure, and respiratory rate. As the body senses of immense of death, it enters fight fight or flight mode, resulting in the surge of cortisol, adrenaline, and other stress hormones. So basically, this is the first stage of the death. This stage, we experience like the we can say short, or maybe we can say the first signs of person becoming weakening, loss of appetite, these things. After this, uh, we have the agonal stage, or also we can call it the final agony. This stage marks the beginning of dying process. At this stage, a person may experience that he is going to die, or he might think like he is dying, and it lasts for few hours, from few minutes to few hours. During this stage, the body organs begins to fail, and the person may experience extreme pain, gasping of breath, and involuntary movements such as muscle spasm, twitching. Blood pressure and heart rate drops further as the body organs fail. So the person may also experience the sense of detachment detachment from the surroundings, and appear unresponsive, although they may still be able to hear and process some sensory inputs. Then we have the clinical death, and this this is basically it's the third stage, and we also call it the reversible death. This stage occurs when the heart rate completely stops, and the breathing process also stops completely. At this point, the person or the body is considered clinically dead, but there is still some brain activity left at this point, and the person during this stage, there is no like detectable pulse, no breathing, no blood pressure, or the person may also appear pale or cyanotic, which is bluish, lightish blue color. And medical interventions such as CPR, cardiopulmonary resurrection, or fibrillation may be used to attempt to restart the heart and breathing. So basically, this clinical death is reversible, and a person can survive from this stage. Then after this, we have the biological death. This stage is considered as the irreversible cessation of the brain and bodily function. During this stage, before this stage, we have the clinical death. At that stage, most of the body organs and heart rate, breathing, they stop, but some of the brain activity is left. But when biological death occurs, the body brain also stop working, At this point, the brain has been without oxygen for certain period of time, causing the permanent brain damage. This may also appear limp and lifeless, and there is no chance of resuscitation, rescuing from this stage. There is no going back. When a person is considered biologically dead, so it's mean it's over. There is no reverse process in the medical to the person for the person, such as like CPR and that things that will not work in biological death. The body the body may also appear limp and lifeless. The body and there is no chance of surviving, as I said. The time of death is usually determined based on the cessation of brain function, although some jurisdiction may also consider the cessation of heart and breathing function as the time of death. So it is important to note that all these stages vary depending on the individual and underlying cause of death. Additionally, not all dying persons will experience the same, but the duration and intensity of each stage is almost same. It may like it's almost same for every person, but it varies from person to person. However, understanding these stages can help loved ones and our patients to treat them more precisely, and we can provide appropriate support and care during the drying process. So that's all for today's topic. Thank you. Stop कर. Record हो गई?